we're in the East Room of the White House with the President and 164 invited guests here who represent all different perspectives on the subject of health care reform. And we have questions for the President. Call this Prescription for America. We had an hour there on prime time earlier before your local news, but the President is going to stay with us. And we have more questions, and there are some critical things that we did not get to in that hour. Most critically of all, in talking about health care reform, there's very controversial subject of whether there needs to be a public option, whether there needs to be government-run insurance as one of the options to get more people insured and for the general nature of health care reform. Your critics on the Republican side of the Senate Finance Committee wrote you a letter and said at a time when major government programs like Medicare and Medicaid are already on a path to fiscal insolvency, creating a brand new program will not only worsen our long-term financial outlook, but also negatively impact American families who enjoy private coverage for their insurance. What do you say to them?
They're wrong. And so let's just explain as clearly as possible what we're talking about. What we want to do, as I said before, was set up a healthcare exchange or a marketplace, essentially giving the American people the same kind of options that members of Congress do or federal employees do. There is a range of options that are available. Private insurers will participate. You will be able to do some one-stop shopping and compare all the different plans, what kind of benefits they provide, what are the deductibles, figure out what's best for you. Now, what we've said is, as one option among multiple options should be a public option, where we set up an insurer that isn't profit-driven, that can keep administrative costs low, and that can serve as competition to the private insurers. Now, what the argument that's been made has been that somehow the public option will crowd out private insurers.
It's not a level playing field.
And that's the argument, that it's not a level playing field. And what we've said is it wouldn't be a level playing field if the government can just print money and subsidize that public plan so that premiums are a lot lower than costs and doctors are getting reimbursed a lot lower than they do in the private sector. Well, that's true. It also wouldn't be a very good plan. But what we've said is that we can set up a public option in which they're collecting premiums just like any private insurer, that doctors are reimbursed at a fair rate, but because administrative costs are lower, we are able to keep private insurers honest in terms of the growth of costs of premiums and deductibles and so forth. Now, you'll always hear folks say that the free market can do it better. Government can't run anything. And what I say is, well, if that's the case, nobody's going to choose the public option. So, you know, the private insurers who I think are very confident that they're providing a good service and a good product to their customers should feel confident that they can compete with just one other option. A lot of the objection to the public option idea is not practical, it's ideological. People don't like the idea of government being involved. But keep in mind that the two areas where government is involved are involved in healthcare, Medicare and the VA, actually there's pretty high satisfaction among the people who participate.
Well, Diane is here with the head of a major insurance company.
If I could, I'm going to bring in Ron Williams from Aetna, CEO of Aetna. And if I can reverse the order a little bit, Mr. President, I'd like to ask a question of him and then let you comment on his answer. Mr. Williams, Aetna, to take one. An insurance company, and we hear all over the country, people see their premiums going up 119% in the last several years. They see the profits of the insurance companies in the billions and billions of dollars, even in the lean year. They see profits in the billions of dollars. Is the president right that you need to be kept honest?
Well, I would first say I would commend the president for the commitment he's made to really try to get and keep everyone covered. And I think as a health insurance company, we're committed to that. In the context of the question that you ask, I think that it's difficult to compete against a player who's also the person who's refereeing the game. And so I think in the context of thinking about a government plan What we say is, let's identify the problem we're trying to solve. Let's work collaboratively with physicians, hospitals, and other healthcare professionals, and make certain that we solve the problem as opposed to introduce a new competitor who has the rulemaking ability that government would have.
Mr. President?
Well, I think
Premiums going
that,
up?
first of all, I want to say that Mr. Walters has been very cooperative. We've been having a series of conversations, and I appreciate the constructive manner in which we've been trying to work together. But I just want to make clear that the government, whatever rules it provides to insurers, a public plan would have to abide by those same rules. So we're not talking about an unequal playing field. We're talking about a level playing field. I also want to point out that one of the incentives for private insurers to get involved in this process is that potentially they're going to have a whole bunch of new customers, paying customers. And if we are, as part of healthcare reform, going to go forward in providing additional coverage to people who either don't have health insurance or who are underinsured. And that's a lot of working people. I just want to be clear. These are people who are working every day and are still finding themselves having a great deal of trouble and oftentimes collecting huge amounts of debt. If we're going to give all these new customers to the insurance industry, one of the things that we should say is in return that we change some of our practices and at least have some competition so that, for example, you can't eliminate people for pre-existing conditions. You can't cherry pick just the healthiest folks. And a public option is one tool by which we can do this. And I think that the insurance companies will still thrive. They've got terrific leadership. Aetna's a well-managed company, and I'm confident that your shareholders are going to do well.
Mr. President, there is a lot of doubts about this as to whether it's a level playing field. The Lewin Group studied this. There's 177 million people in this country with private insurance through their employers. That group estimates with government insurance that employers will go to that because it'll be cheaper. And they estimate, the head of the Lewin Group, I believe, is here, Mr. Shields, they estimated that 2/3 of people would go to the public insurance option. Let me get you a microphone. Can we get him a microphone, please? Thanks.
Well, we looked at several different options. You could design it in several different ways. There was a particular scenario that people looked at, and that's what got all the attention. It's one where the premiums would be, for a family, for example, would be as much as $2,500 a year less than in the private market. The reason for it is that they paid they use the Medicare payment reimbursement methodology, and they pay physicians a lot less, hospitals a lot less. So the premium came out as much as $2,500 a family lower in that particular scenario. That's pretty attractive. We estimate that 70% of anybody with private insurance would make the shift to the public plan.
Which would be millions of people going over to public insurance. You keep saying, if you have what you like, you can keep it. But if your employer goes over to the government program, maybe you can't keep what you have.
First of all, I think it's important to understand, and I think the Lewin Group acknowledges this, that there are a whole series of ways that we could design this. One of the things that we've said is that if you are eligible for your employer plan, then you can't just go into the public plan. Yeah, you can't decide that you're already having a pretty good deal in insurance and you're just going to dump that, what's called a firewall. The other thing we're doing is we're saying to employers to provide them a disincentive for just dumping people out of existing plans is there's going to be a pay or play provision. If you're not providing health insurance to your employees and you're a large employer, you're going to have to kick in a certain amount of money because it's not fair for taxpayers to have to cover your employees, whether it's through a public plan or through uncompensated care, essentially sending people to the emergency room, which, by the way, adds to all of our premiums collectively about $1,000 a year. So we would I think there are some legitimate questions in terms of how the public option is designed.
Right.
One thing I have to say, though, is it's not an entirely bad thing if, as long as they're reimbursing doctors in an adequate way, and so not being oppressive on healthcare providers, and as long as there are not a whole bunch of taxpayer subsidies going into a public plan, If the public plan can do it cheaper and provides good quality care, that's the competition that we talked about. I don't think you're going to get a lot of complaints from people if the deal is a better deal. If it's not a better deal, then people aren't going to choose it. But what we think is that we can set up a system in which you are expanding choices for individuals as opposed to constricting them.